So our today's topic will be protozoa as well as your nematodes. First we will cover protozoa. So the whole protozoology I have divided into four parts. Okay. First part is something which are having unusual shape. They can change their shape. We call them amoeba. A group of protozoa which can change their shape. We call them amoeba. And the second group of protozoa which have something like this, maybe four pair, maybe three pairs, we call them flagellated. These are your flagellated protozoa. Then one more category, that is very small hair-like projections. These are your ciliate. These are your ciliates. And then next is some kind of protozoa which are having a modified cap-like structure. This cap. So we call them epicomplexa, having apical complex, and they are known as sporozoa. So these are the four main categories where your protozoology is divided. First are group of amoeba. They may be free living amoeba and intestinal amoeba. Second is flagellated one. These flagellated again divided into your intestinal, which affect your GIT. They may be your blood flagellates like leishmania, trypanosomes, and there is only one protozoa comes under the category of ciliate, that is known as your B. coli, Balantidium coli. And this sporozoa, they may be your blood, that is Babesia, Filaria, and that may be like tissues. Inside the tissues, Toxoplasma gondii, and that may be your intestinal. That include coccidia. So in this way, your protozoology is divided into four parts. First is group amoeba. Second, flagellated. They include intestinal flagellates like Giardia, Histomonas, and your Hexameter. And second is your blood, Leishmania and your trypanosomes. Ciliates, there is only one, that is Balantidium coli. And the sporozoa having apical complex, they are epicomplexa. They may be similar to these. For blood, we have Babesia, Thylaria, and other. And for tissues, we have Toxoplasma. For intestine, we have Coccidia, Isospora, and many other sarcocystis like this for tissues. So first we start with the group amoeba. In case of amoeba, there are total four groups. We call them ant amoeba. There are four groups. One which is related with the teeth, gingivalis. So on the basis of their cyst contain one nuclei, their cyst contain four, or the cyst contain 8 nuclei. These are divided. So gingivalis G for 0. Remember like this, G for 0 means there is no nucleus inside the cyst. If there is O is there, O means 1, and that one may be your bovine. And there may be 4 nuclei present in the cyst, and we write 4 like this, and if we make it invert this, it will become histolytica. So this is the 4. And the remaining group is your coli group, having 8. So out of these 4 groups, 0, 1, 4, 8, only 4 nucleated cyst containing amoebae, they are the pathogenic one. Other 3, they are normal commensals, they are non-pathogenic. So this is our target, Ant amoeba histolytica. Ant amoeba histolytica. H4 means the cyst contain 4 nuclei. So in case of protozoology, if you read protozoology again and again, you will find 2 terms most commonly. One is trophozoite and another is cyst. Just like your uh, trematodes, there was Miracidium, Sporocyst, Radia, Cercaria, Metacercaria. These were some 4 to 5, again repeating terminology. Similar to this, we have trophozoite and we have cyst. These two will come again and again. So starting with ant amoeba histolytica. This is the pathogenic and the host is your human and rarely some ruminant or cattle like and dog. So mostly they are the protozoa of man, cat, dog. But out of these, man is more important. So the first, if we start with the mode of transmission, then the mode of transmission will be your two things. These are this means food and your water. So this protozoa and amoeba histolytica enter inside your body through the feco-oral route, means through the food and water it will enter. This food and this water contain something four nucleated structure, and this nucleated structure is your quadrinucleate. This cyst is the infective and with the food, with the water, this cyst enter inside the body. Once it enter, then if we remove this GIT outside like this, okay. So the location of our parasite is large intestine. The location is large intestine. So the mode of transmission, food, water, and this is the infective stage is cyst. Cyst enter and it will reach into the large intestine. So now we are here with our cyst having four nucleus. So quadrinucleate cyst was the infective stage. Okay. Then after reaching the large intestine, it will convert itself into one structure that is known as trophozoite. That is known as trophozoite. So cysts are converted into your this structure trophozoite T. This trophozoite have some attachment with the intestinal wall and these are known as lectin receptor. Because of this receptor, it will attach with this intestinal wall. Suppose this is the wall. So the trophozoite attach with the wall. This trophozoite is known as pathogenic form because this is the trophozoite responsible for pathogenicity. So once it attaches itself with the wall, then it start eating the wall. It start eating, and This trophozoite, it will eat the wall, it will damage the wall in such a manner that it will create some structure like this. It will digest the wall of the intestine like this. And this digestion, this structure is known as flask-shaped ulcer. And this was the MCQ in your ICAR 2020 exam. That flask-shaped ulcers are associated with which protozoa? And amoeba histolytica. Next time, if they ask you that this flask-shaped ulcer is associated with which form of the entamoeba histolytica? So there are two forms, cyst and trophozoite. This is mainly associated with the trophozoite. So they eat the wall and they form these multiple flask-shaped ulcers. So this is the first. If this trophozoite, if we make the wall this side also, and if the same this trophozoite, it keep on eating and make another flask-shaped ulcer, another flask-shaped ulcer. So in this manner, this trophozoite, after some time, it will perforate. It will perforate. So this is the trophozoite. It perforates anywhere your intestinal wall. After perforation, it will reach outside the intestine, that is known as extraintestinal organs, and the favorite organ of this trophozoite will be your liver. It will enter into liver and start damaging liver. So in case of entamoeba histolytica, there are two main forms are found. One is intestinal, and the pathogenesis related with this form is the flask-shaped ulcer. Once it perforates the wall, it will come outside. Outside means where? Extra-intestinal. Then it will reach to the liver. And in the liver, it will damage the liver parenchyma, and that may lead to further hepatic abscess formation. And the liver becomes some chocolate color. We call it chocolate liver. So the MCQ is this, that which form of your ant amoeba histolytica is found in liver? This is the liver. So which form is found? Because there are only two forms. One is trophozoite, one is cyst. So inside the liver, you will find trophozoite. If you do the biopsy specimen or any other thing and try to find out of cyst and trophozoite, you will find trophozoite. So again repeating, food enter large intestine. With the food, what comes in? Cyst. Cyst is quadrinucleated. Cyst is your infective stage. Cyst become your trophozoite, attach with the wall, start damaging. Initiate from small ulcers, then keep on damaging, form flask-shaped ulcer. Further damage may lead to the perforation of wall. Perforate the wall, enter some extraintestinal organ, which is more commonly liver. If liver is not given, then answer will be lungs. So it will gives you damage to liver. That may lead to jaundice, bilirubin, other things, whatever with related with the liver. So this is the cycle with intestine and the liver. Some of the some of the trophozoite, they convert, suppose this is trophozoite, they convert into immature cyst. First, they convert into immature cyst. Inside the body, the cyst itself become mature. Once the cyst becomes, it will come out. So if we take this as a human or as an animal, then from the body through the feces, what comes out? There may be trophozoite, but they come very, very rarely. Immature cyst may come out and mature cyst can come out. So what is the fate? What happens with this immature cyst? Outside the body, they will never convert into mature cyst. They will be disintegrated. These cysts outside the body, these cysts will survive, and if you take a stool sample and examine under microscope, you will find mature cyst. That is the diagnosis of ant amoeba histolytica. And if you find trophozoite, that will confirm the infection that this is the trophozoite and this is the ant amoeba histolytica. So if we say that what is the usual or routine diagnostic form in case of ant amoeba histolytica? So in case of ant amoeba histolytica, what comes routine will be your cyst, and that cyst is quadrinucleated, containing four nucleus. Why quadrinucleated? Because this is your histolytica group. This is your because of H, we can call it four. So there are four nuclei. So this is the diagnosis of your entamoeba histolytica, where these are the cysts. Then what is the treatment? That is drug of choice is metronidazole. So metronidazole is your drug of choice. So if we sum and amoeba histolytica, and one more thing, ant amoeba we have studied four groups. One is without nucleus, that was your zero. One was your bovine, that is one nucleus. One was with your histolytica, that was four, and there was eight. So these are the commensals. These are the commensals. How to differentiate our pathogenic form with these non-pathogenic or commensal forms? So only two differences are there. Normally, we differentiate our histolytica with entamoeba coli because this is the normal flora. Gingival is mostly found not found in that large intestine. So we differentiate with entamoeba coli with our histolytica. So only two difference. One difference with the trophozoite. That is T. In case of both the trophozoite, there is one difference that here you will find finger-like projection. But in case of this, you will find a small protuberance. So we can say these are the trophozoite of this and this. Second difference we can find with the cyst. Because histolytica this is 4, so there are 4. Coli group there are 8, so we'll find 8. So this is how we can differentiate that this is the normal, this is normal flora and this is the pathogenic one. So this finishes our entamoeba histolytica. So in case of entamoeba histolytica, if we revise, what is the infective stage from where the infection start? That is your quadrinucleate cyst. Then it will enter the intestine. Cyst convert into trophozoite. Then what is the pathogenic form? This is your trophozoite. It will form here that many flask-shaped ulcers. Many. So this is the pathogenic form, and also this is known as invasive form. Invasive form. Why invasive form? Because it invade the wall, comes out, and it will enter into your liver. Enter into your liver. So form, fecal root, large intestine habitat. T is the pathogenic form, flask-shaped ulcer. Outside is liver, chocolate color abscess or liver. Then last is your diagnostic form. that is routine diagnostic is your cyst. So these are the MCQs related with your ant amoeba histolytica. Then next,
Hello?
hello.
Sir, trophozoite to immature cyst conversion take place in large intestine only.
Yes, in case of ant amoeba histolytica, mature and immature to mature. These things convert inside the lumen of the intestine. Trophozoite enter into the liver, then it will not convert into the cyst. So this trophozoite convert immature, then mature, then from the body what comes out mature. Sometimes without conversion into from immature to mature, they also comes out. But outside the body, in the environment, they will never disintegrate. So we can say that in the stool, diagnostic form mostly is the mature cyst. And one more thing about the cyst. Cyst form under unfavorable condition. Unfavorable condition. To survive under unfavorable conditions, these are formed. So trophozoite is the pathogenic or breeding stage. Or one more thing, if you find trophozoite, inside the trophozoite there are some food vacuoles. There are some food vacuoles. Within the food vacuoles, you will find RBC. That differentiates from the trophozoite of E and amoeba coli. In the food vacuole, RBC are not found. But in case of entamoeba histolytica food vacuoles, you will find RBC. So the conversion of trophozoite to immature cyst at the lumen, not outside the body. Then, as we have divided into four groups, first protozoa will be your amoeba group that is done with your entamoeba histolytica. Now the second one. Second one is your flagellates. Having flagella on their body, these are two nuclei and the nose is the exostyle. So we start with the flagellates. Flagellates are also of three types. First we'll do intestinal flagellate, means those flagellate which affect your GIT. Starting with two hexameta and your giardia. Giardia. Okay, let's start with that way. The whole life cycle and the whole story of your giardia is similar with your entamoeba histolytica. In this case also you will find some food and your water. And in this food and water, again the infective thing is your cyst. This is your cyst. And this cyst is having nuclei. This cyst is having number of nuclei. So infective stage is in this case also cyst. And that cyst is present inside your food. But the difference is from the entamoeba histolytica, this is the GIT. Now we enter into small intestine. In case of entamoeba histolytica, there was large intestine. And which part of small? Mostly duodenum. So this is the small intestine. Now, after eating this food and water, what comes in? Your cyst. Cyst come. Cyst convert into trophozoite. This time, this trophozoite is pear-shaped. Pear-shaped. And this trophozoite carries one, two, three, four. One, two, three, four. Four pairs of flagella. And these two eyes are two nuclei. These are two nuclei. And these two lines which make the nose, they are two exostyle. So this is the morphology of your trophozoite of Giardia hexameta. But one more thing that is important, on the ventral surface, it is having some structures to adhere with the wall. And these are known as adhesive disc. These are known as adhesive disc. So with the help of this disc, this parasite adhere with the mucosa of duodenum. Mucosa of duodenum. So the infective form is cyst and the pathogenic form is your trophozoite. And the morphology of trophozoite of Giardia, it was asked in ICAR 2018 that monkey face appearance trophozoite are seen in. So these are your monkey face, Giardia. The structure is monkey face. So monkey face appearance of trophozoite is found in the Giardia. So this is your pathogenic form or invasive form. But the difference between your Entamoeba histolytica and this Giardia, it will not cross the intestinal wall, never. And the second thing, it will damage the wall, but it will not form such deep ulcers that were found by your Entamoeba histolytica, what we call flash shape ulcer. So ulcers are there, but they are superficial. Damage is superficial, and the second difference is it will not enter into your extra intestinal tissue like liver. So these are two difference. So what is the pathogenicity related with this trophozoite of Giardia? That is malabsorption or diarrhea. So with this pear-shaped two nuclei, two exostyle, and your four pairs of flagella, what it causes? It causes malabsorption syndrome, and this syndrome is known as giardiasis. Giardiasis, and because of malabsorption, there is fat will come in the stool. When the fat comes in the stool, we call that condition steatorrhea. Steatorrhea. So this is your MCQ. Steatorrhea and malabsorption syndrome is characteristic in case of giardia. Because of this, when fat comes out from the body, the fat soluble vitamins, that is your ADEK, will be deficient. So if we compare these two, this Entamoeba histolytica and our Giardia, then what is the difference? In this case, in the feces, we find cyst. Okay. In case of your Giardia, in the feces, we find cyst. Both are common. But what is more important is fat. Steatorrhea condition. In the feces, we find fat. That is because of malabsorption. Because vitamin A, D, E, K, they are not absorbed, so you will find deficiency of vitamin A, D, E, K. And in case of Entamoeba histolytica, what was the extra intestinal tissue? Liver. But in this case, liver not involved, no flash shape ulcer, no more damage. So this is as compared to this, we can say less pathogenic giardiosis. Then, if we compare giardia with that hexameter, this hexameter is mainly of birds, and in the birds, if they ask you only the remember turkey, mainly turkey. In both cases, the trophozoite are pear-shaped. In both cases, two eyes means two nucleus. Both the cases exostyle. Okay. Both the cases four pair of flagella. Then what is the difference? The difference is in case of your giardia, there are disc. These are not above the nucleus, but they are opposite side, ventral surface. These discs, they help the trophozoite, and because of this, at the site of duodenum, it attaches with the mucosa. But these discs, they are not present in this case, so this trophozoite is less pathogenic as compared to your giardia. So these were the three intestinal protozoa, where one was amoeba group and two were your flagellated group. And the next flagellated is your histomonas. So next is your histomonas. So what is the story of histomonas? Because histomonas it is related with the birds. Similar to Entamoeba histolytica, similar to Hexameta and Giardiosis. In this case also, there is food and there is water. There is food and water. This time, this food and water carry some egg. This is the egg. Egg of Heterachis gallinarum. Heterachis gallinarum. Inside this egg, what we find? Histomonad. Histomonad. Your protozoa. So the protozoa of the uh, genus Histomonas, it is present in the eggs of your Heterachis gallinarum. And the Heterachis gallinarum is also known as cecal worm. So these cecal worms, they carry these histomonas in their egg. So if we start with the story of this histomonas, then from the food or water what enter inside eggs, and the site you have to remember two. One is your cecum and one is your liver. Because the pathogenesis is mainly related with these two parts. The eggs containing your histomonas enter the cecum. What happens inside the cecum? If we bring this cecum outside, suppose this is the cecum and this is the histomonas. The protozoa multiply and it start damaging and form some pinpoint ulcers. Initially, it formed pinpoint ulcers. Later on, these ulcers coalesces, fused, and they lead to large ulcers. And in this way, the uh, cecum also enlarge in size because of inflammation and these ulcers, and this may lead to your cecum large necrotic ulcer formation. So this is the pathology with the cecum. Some of them, through the portal circulation, they enter into the liver. So what happens in case of liver? This is the liver. These protozoa, they form circular lesions. These lesions are circular. But these circulars, they are depressed from the side of the surrounding parenchyma. It means these are button-like or these are circular necrotic lesions. They are depressed from the surrounding area, and this is the characteristic of your histoma. And the bird is your turkey. So two pathogenesis, one with the Zika, one with the liver, and the third thing is related with these structures, what we call vettals. They becomes cyanotic. They become cyanotic. So because of that cyanotic, we call this disease black head disease. So vettals and the skin of the head that becomes cyanotic, black head disease. Come to the vent area. From there, what comes out? Sulfur yellow color droppings. Sulfur yellow droppings. So this is the whole story of your Histomonas miliacriti, where two organs are mainly affected. One is Zika, initially pinpoint ulcers, then they fuse with each other, and that may lead to the large necrotic lesions. And second case is the liver, where you find circular depressed ulcers, necrotic lesions in the liver. Third thing, Wettels skin becomes cyanotic, we call it blackhead disease. Third thing, with the droppings, they are sulfur yellow color. And the fourth thing, what it was eating, that egg of the sickle worm Hg, which contain inside them histomonas protozoa. So this protozoa is present within the egg of the worm. So this is the cycle of histomonas because this is also a your flagellate. If you look at the structure of this flagellate, then this is the structure where there is one flagella and one nucleus. This is your histomonas. One flagella, one nucleus. Then one more flagellate which affects the intestine or you can say GIT. That is Trichomonas gallinae. Trichomonas gallinae. Again, gallinae means birds, and which bird? This time pigeon. So Entamoeba histolytica affect man, dog, cat. Then Hexameta affect turkey. Giardia man, dog, cat, other. And then your Histomonas miliagradis mainly affect turkey. But if all other options are given, then poultry also. Then the last flagellate of your GIT, Trichomonas gallinae. That is related with the bird pigeon. So the story of this is little different. So this is your baby pigeon, and the baby pigeon they are known as squab. This Trichomonas gallinae is a protozoa which affect the upper GIT system. Upper means like esophagus, crop, and proventricus like this. But the mode of transmission is not from the food and other thing. The mode of transmission is something different than others. This is the parent and this is the baby. From mouth to mouth, what comes out? Pigeon's milk. Pigeon's milk. When the parent feed their squab through the pigeon milk, so if this is the GIT and this is the crop and other structure, inside the crop your Trichomonas gallina is sitting. When from the crop we know this pigeon milk is synthesized and this milk when it comes and it enter the GIT of your baby, then what is transfer? Trichomonas gallina. This Trichomonas gallinae will affect the upper GIT, means it will affect esophagus, throat, proventricles like this. This is the mode of transmission. So after the protozoa is entered inside the body of this squab, then it will affect these structures, esophagus, throat, and others. This will damage the intestine mucosa and cause some inflammation. Because of that, the fluid accumulate and that fluid accumulate in the crop and that comes out or may be present at the mouth at this region, beak. So greenish fluid accumulate and that may be found at the area of your beak and that may also exude out. So this is the story of Trichomonas gallinae. The structure of this Trichomonas gallinae is very simple. This is the Trichomonas means they have pear-shaped body. They have pear. One, two, three, four. Four anterior flagella, but there is no posterior. So this finishes GIT flagellates. The next is our genito, genital flagellate. We have one flagellate that affect the genital organ. So we call them genital flagellate. In 2019, there was one MCQ from this genital flagellate, and from 2018, again MCQ from the morphology. So this genital flagellate is nothing but your Trichomonas fetus. This is the T fetus. So in 2018, they have asked one MCQ about the morphology. With the morphology, that is pear shaped. The morphology is the pear shaped. This Trichomonas fetus, one second. The first MCQ was with the morphology. The Trichomonas fetus, there are total four flagella. There are total four flagella. So how to remember? Trichomonas. Tri means three. So three flagella will remain at one side. At this side means three will remain together. One is 3 plus 1. 1 will be starting like this. It is trailing posteriorly. So 3 anterior and 1 posterior. This was the MCQ. In case of T fetus, arrangement of flagella. And there is one eye we call one nucleus. And one more MCQ that may be your future MCQ, that this exostyle. In case of Giardia, exostyle is present. If we compare these three, uh, this Giardia 2 and this was the exostyle. But in case of T fetus, this exostyle, one nucleus, this moves little bit outward. So we call that exostyle emerges outside. So this is the difference between your Giardia and the Trichomonas fetus. So this morphology is also very important, that exostyle protruded out and there is one, two, three hairs at the head, and this is the fourth one. There is one nucleus, and the exostyle moving out. And the second MCQ with the Trichomonas fetus, the location, that is your uterus and vagina in case of cow, and it will cause first trimester abortion. First trimester abortion. So these are the two MCQs related with your Trichomonas fetus. And this Trichomonas fetus, the mode of transmission is very simple. That is, it is venereal transmission, that is through the coitus or your gynecological instrument called ICAR. So this was the simple flagellate. The next, hemoflagellates, means flagellates which are found in the blood. So without any shape, that was your amoeba. Flagellate having flagella. They were of GIT. So GIT flagella were Hexameta, Giardia, Trichomonas, Gallinae, and Histomonas. Then flagellate of genital was fetus. So 1, 2, 3, 4, 5, 6 protozoa are completed. Next we start with the hemo, that is blood flagellate. Means a protozoa having flagella but it is present in the blood. So there are only two flagellates which are present in the blood. They are your trypanosome and leishmania. So trypanosome. So hemoflagellate. One is trypanosome, second is your leishmania. In both trypanosome and leishmania, four forms are present. Out of these four, in some case four are present, in some case two are present. So that forms are known as apet clinic. A for amastigote. A for amastigote. The term mastigote means flagella. So these are the hemoflagellate, where amastigote means no flagella. There is round body. I think mic किसी का होना है. Is off your mic. Outside no flagella, but inside there is one structure called nucleus, and this remnant of flagella which is present inside known as exoneme, and structure is round. So this is known as a mastigote form. So similarly, in total there are four A, P, E, T. Second is promastigote, elongated body. In the center we have nucleus. Basal body, also known as kinetoplast. From this, a small flagella comes out. This is your promastigote. Then epimastigote, again elongated body. In the center you have nucleus, but this time the kinetoplast, and this is lateral one. Flagella is lateral one. Okay, in this case, undulating membrane is absent. Means membrane which is moving like wave like. But in this case, lateral flagella, that is arising laterally, and this is anterior to nucleus, and small or short undulating membrane. This is epimastigote, and the last is your tripomastigote. Tripo is your leaf-like structure which is having a central nucleus, and suppose this is the anterior end and this is the posterior end. At the posterior end there is kinetoplast. That structure gives rise to flagella and undulating membrane well developed, and this is the flagella. So these are four: amastigote, promastigote, epi, and tripomastigote. So in case of trypanosome, all the forms are present. If you look at trypanosomes, all the four forms are present. But if you look at the Leishmania, only two forms, AP forms. Amastigote, that is nothing but your round, small this nucleus. So amastigote is also known as, if we, this is the nucleus, if we call this nucleus as a dot, it is called dot, and this exoneme is also called as dash. This is structure also dot and dash structure. Second is promastigote, that is elongated one, nucleus, athletic. So these two form present in Leishmania, and all are form present in trypanosome. So we will start our story with the trypanosome first. So because these four forms are important to read, they comes into the life cycle of trypanosome and Leishmania. So before going into the life cycle of trypanosome transmission. How do they transmit? So that transmission may be cyclical and that may be non-cyclical. Cyclical means inside the body of vector there is development. Non-cyclical means no development. So we can say this is your mechanical. This is your mechanical. So what is the meaning of this development and this? Cyclical may be, suppose this is your tabanus or anything. If you divide the body of this insect into two parts, this is the anterior part, suppose this is the posterior part. So this development may occur in the anterior part, we call it anterior station development. And if it inside in the hind gut or hind portion, we call it posterior development. So this is nothing but a development of the parasite, where your promastigote or amastigote, all these stages they multiply inside the body of your vector. That may be tabanus or that may be phlebotomous. So if they multiply in the foregut, okay, anterior part, so accumulate, they will accumulate like your promastigote accumulate into salivary gland. And when the insect bite the host, then through the bite, through the saliva, they will enter into the body of host. But in case of posterior development, if you take one example of your bug, kissing bug, red-wheat bug, suppose this is the bug and this is the posterior part. The development is in the posterior part. It means things will come out like promastigote or any form that will come out with the pieces of your bug. So this is known as transmission related with your trypanosome. That may be cyclical, that may be non-cyclical. Cyclical means there is development. That may be anterior part of your insect or that may be in the posterior part. If anterior part, then it will inoculate through the saliva. If it is in the posterior part, it will inoculate through the feces. Then the remaining is your mechanical, non-cyclical. It means, suppose we take one example, T evansi. Then the mechanical vector is Tabanus and Stomoxis. These are two examples. So based on this flow chart, there was one MCQ, and that MCQ was T. evansi is transmitted by, and options were cyclically by Tabanus. Second option was cyclically by Stomoxis, and C was mechanically by Tabanus. So these were three options. So which one is correct? Cyclical or mechanical? So answer C, I think, is correct, because this is the mechanical one. What does it mean? This is your insect. So inside the body of your insect, there is no development inside the tabanus or stomach. So these both are wrong, because cyclically means development. Mechanically means it will take the form, that may be a mastigote, promastigote, and from here the enter inside the body, but no development. Again, it when it bite a next animal, then deposit the form. So no development, neither in the anterior part nor in the posterior part, just mechanical. So this was MCQ. T1 side mechanically by development, not cyclically. So next we will start with our life cycle of Tabanus, your trypanosome. This is very simple life cycle, because in case of trypanosome, the infective stage, or you can say infective form, and diagnostic form, both are T. So in case of trypanosoma, T for T. Infective form is also trypomastigote, and diagnostic is also trypomastigote. So the whole story will be of trypomastigote. So what is trypomastigote? As we have studied four forms, a pet clinic, that was a pet. So this is the trypo. So this is found in blood, that is your diagnostic form, and this is also present in your tabanus, that is infective form. So the host which are related with your trypanosome, that may be camel, cattle, dog, and horse, CDH. And this is your tabanus. The most important characteristic feature of this tabanus, is your interrupted feeding habit. The whole story, whole life cycle is based on this point. Interrupted feeding habit. The fly bites this animal, then again it flies, and then again go to bite another one. So it keep on biting, interrupted feeding. So we start with our host, that is maybe cattle, camel, dog, and horse. So after doing the interrupted feeding, this tabanus, this is the circulation of your animal. In the circulation, what we have? Trypomastigote. that leaf-like structure. The Tabanus will take the meal. Tabanus will take the meal, and through the meal, it will carry trypomastigot. Suppose this is the next animal. Tabanus reaches here, and it will bite this animal, and during the bite, what releases? The form trypomastigot, because there is no development from amastigot. In the Leishmania, we will see that amastigot will transform into promastigot, pro into amastigot. That transformation does not occur because this is simply a mechanical one, no development. So it will take the tea and again put the tea back. So if we look at this host, what happens in the blood of this host? The tabanus deposited this form. This was the animal in the circulation. In this circulation, we have this one, nucleus and kinetoplasm, and like this. So this form, trypomastigot, this is present in the blood. We call trypanosoma intercellular, or we can call it extracellular. These are the RBCs. These are the RBCs present around it. So this is not present inside your cells. It is inter, or you can say extracellular. This form. So once this is deposited in the blood, then this trypomastigot, it's a longitudinal structure. It's a longitudinal structure. So it will divide longitudinally also. So from 1 to 2, 2 to 4. So there are multiplication. There is multiplication of this parasite inside the blood. During multiplication, suppose this time it is having star antigen. After multiplication, it will become square-shaped antigen. So this is the reason why vaccine is not available for trypanosomes, because it keep on changing its antigenic character. It shed the antigens, again modify its antigens. So because of these antigenic variations, there is no vaccine available. And this was the MCQ in 2019, that the immunoprophylaxis is not possible for trypanosome because of variation in this antigenic variation. It keep on changing antigens. So it will multiply in the blood. So again, some because of interrupted habit, again Tavanus comes, then take the meal, deposit into another animals, then the trypomastigot form will multiply by longitudinal and keep on multiplying. Then what is the pathogenesis it causes? Because this form is present in the blood. These are the surrounding RBCs. So because of this flagella, this mechanical movement, it can damage the RBC. That may lead to your anemia. So the first cause of anemia may be your mechanical damage. Second thing, it will release some H hemolysins that may damage. Again, anemia. So because of hemolysins. Then erythrophagocytosis inside the spleen and other organs. So all these things they lead to anemia. The second thing, this trypanosome require glucose for its metabolism, for its energy, and the host glucose is utilized by this trypomastigot. So it will cause hypoglycemia. Hypoglycemia. That may cause hypoglycemic shock. That may cause death of the animal. Other is immunosuppression. Immune suppression. It may suppress the immunity of the animal. So this is the pathogenesis. In case of clinical signs, the more specific feature in case of horse, suppose this is the horse. So the first important thing is the urticarial patches. In some urticaria, like this skin patches, or the second thing in the horse is these are the legs, edema of this lower part and this lower part, edema. That may lead to the lameness, some urticarial patches, and more important is that is common in case of this is progressive, not fever, anemia. And intermittent fever is common in all. So these are some signs in horses, but in case of dog, more important is the eyes. That is both side bilateral corneal opacity. Corneal opacity. And cattle, in case of cattle, there is some CNS sign like staggering gait, convulsions, paralysis, and death. This acute form signs, these were asked in 2019 in our PSC VO exam. Signs are the signs in acute phase of your trypanosome in case of cattle. So these are the some nervous signs. The last is your camel. Of camel, mostly trypanosoma is chronic in nature. Chronic means duration will be 3 years. Because of three, there is one name is given TIBERSA. So camel, it is chronic 3 years, and this is deeper. With the diagnosis of your trypanosome, wet film examination at field level, take the blood sample and examine under microscope, you will find the trypomastigot form. And these are your longitudinal nucleus. This is your trypomastigot. So wet film. But there are some other tests for bovine. B4 we have stilbamidine test, and for camel, the name itself ME, you have mercuric chloride test. So these tests were asked in exam. That mercuric ME, mercuric test is for what? For camel. And stilbamidine B for bovine. So they were asked. And wet film is the field level test, simple rapid test. Because you take a slide and just see, you'll find this one. Then drug of choice, your quinpyramine sulfate and your chloride combination. Then how to remember that? That combination is called antricide crosalt. There is sulfate SO4 plus your chloride Cl2. So this is the two. So they are combined in ratio of 3:2. Then how to remember which is 3, which is 2? If you look at SO4, 1, 2, and 3. There are three things, S, O, and 4. So this is 3. And Cl2, chloride, and 2. This is 2. They are combined in 3:2. And out of these, there is sulfate and chloride. Sulfate is soluble. Sulfate is soluble. It will go inside the body and kill the parasite, and sulfate will save the animal. It is of curative importance. It is of curative one. But the chloride is for the prophylaxis. That is, before rainy season, if you administer this will give you prophylaxis up to 90 days. So this is the property of chloride. So if we combine both 3:2 ratio, then we'll get the benefit of both the things, curative as well as your prophylactic effect. So Mizilate is your Leishmania, Donovani, we call it Leishmania. So in case of
Hello?
if you remember, hello, a pet, yes.
Sir, what about dollar spots?
Okay, dollar spots. These are in case of Trypanosoma equiperdum. There is one trick to remember. Three stages in this. First time, the things will be seen in the that is edema. Second is the cutaneous form, your skin. So below the skin, these are your dollar coin like skin lesions. And the third is stage is your paralytic stage. So OCP. So this will spread by coitus. So to prevent the coitus associated birth, we give oral contraceptives like that. OCP. First is edema in the body, like your genital organs, edema of vulva, prepuce, penile organs. Then in case of cutaneous form, these are dollar spot. They are like a dollar coin beneath the skin, and after few days they will disappear. And this paralytic form cause hind leg paralysis and convulsions and death. So this was the equiperdum, which is venereal. And similarly, in case of trypanosoma, there are two more types. That is, one is your American and one is your African. American is known as Chagas disease. Chagas disease of having two manifestation, one is acute, one is chronic. In case of acute, suppose this is the skin and this is your fly, that is your tabanus. At the site of inoculation, this site, there will be some swelling. There will be some swelling, and that swelling is known as chagomas. Similarly, if you look at the eyes, around the eyes there are eyelids, they become swollen. We call them Romana, Romanas sign. Means around the eyes there is swelling. Romanas sign, and the swelling at the site of inoculation, that is chagoma. But in case of chronic, we will find many megacolon, myocarditis, then muscle pain, like this. So this is your American. And in 2019, the simple etiology-based question was there. Chagas disease is caused by T. cruzi. And the vector is your kissing bug, radovid bug. When it, suppose this is your skin, a- and when the bug, it causes, it bite you, then because of bite, there will be some abrasions, and you do the scratching, and because of that scratching, the parasite will enter inside this. So this is your radovid bug related with the cruzi. So Chagas disease we can easily remember from the name itself, central and the south. And this A will help you to remind it is American. This is found in Central America, South America. This is American trypanosomiasis, Chagas disease. Then there is one more, that is African. There is African. That is called Trypanosoma brucei. And there are two brothers of brucei. One lives in East Africa and one lives in your West Africa. How to remember which lives where? So this W will help you to remember that T. brucei gambians. So make this M just opposite, it will become W. So it lives in the West Africa. In the east, we have T. brucei and that is rhodesians. E is there, East Africa. One more thing about rhodesians, the reservoir are rodent. So rodent are the reservoir. And one more difference about this West and East African, there is involvement of the lymph node. Suppose TB Gambian and this is your TB rodency, rodent 1. If you make this M and B want to utilize is M becomes W because it belongs to West Africa. Then we call it winter B for bottom, winter bottom sign, which is nothing but your cervical lymph node enlargement. So in this case, lymph node involvement is common, but in case of rodensiancy, lymph node involvement is not common. So these are two. This M means make it W, West African. Rodensiancy E is there. This is East African. Both causes your sleeping sickness. And the vector is from these two sleeping S also. This is CC fly, also known as your Glossina. So with the trypanosomes, we have Evansai, then we have Cruzi, then we have your African, American, African also divided into two parts. Is
Excuse me, sir. Hello.
hello, huh?
So, what are the developmental stages of trypanosome events inside the definitive host?
Inside the definitive host. See, inside the definitive host, once this tabanus bite, it will leave trypomastigote. And this trypomastigote having this structure, leaf-like structure, it will keep on multiplying by the longitudinal binary fission. So you will find there are many trypomastigote. So if you take this blood sample at this time, okay, suppose this bite and there is multiplication, and at the same time, if you take a blood sample and look at under the microscope, you will find your trypomastigote. That's why we call it the diagnostic form is trypomastigote. And what deposited was also trypomastigote. But in case of Leishmania, both forms are different. Means infective is A mastigote and that diagnostic is other. But in case of trypanosoma, both are same. So that I was talking about Leishmania. There are two forms A and B. A means amastigote. A means absent, mastigote means flagella, no flagella. If you make a line, this is the short axoneme and this is the nucleus. And we also call this dot and dash appearance. Okay. Then promastigote, it is elongated one. Pro means proximal, there is nucleus. What is proximal? Flagella. AP form in your Leishmania. So let's start with the life cycle, how the Leishmania causes. So in case of Leishmania, uh, this is your dog or human host. Then in this case, the fly, the fly is your sand fly. Fly is your sand fly. And what before going to life cycle, these AP forms amastigote, okay, and promastigote. So we have two things. One is vector, one is human. If we look at the amastigote form, in the name it is carrying that this form is present in MA. So MA means man. It is present in the man. It means in the blood you will find amastigote. And this pro is present in the P for P, phlebotomous. So if this is phlebotomous, it is carrying P. So very simple that amastigote present in your man and pro is present in your P, phlebotomous. So when first time, suppose this phlebotomous is sterile, it is not infected, and this is your host. So inside the host you have blood, and inside the blood we have macrophages. So amastigote form MA present in man. If we further extend this MA, then that MA will give you macrophage. It means if you enter the body of man, inside you will find macrophage. And inside this macrophage, this A mastigote is present. It means inside the blood, this is your macrophage and this is your A mastigote. So when for the first time this phlebotomous comes, take a blood meal. So what she is taking? She is taking A mastigote. Means she is taking blood meal. Okay. In that blood meal, what is there? Macrophages. So ultimately, A mastigote taken up along with the blood meal. So remember this sequence because the whole life cycle of stories depend on this sequence. A mastigote, MA, man, MA, macrophage. And this is your animal having macrophages and they enter. This is the body of your fly. Inside the body of your phlebotomous, what comes? A mastigote. But this, if you compare simply take the tripo and next host. But in this case, this is cyclical. Cyclical means there are four forms, as we remember, A, pet, four forms. So this form, A mastigote form, will convert A into P. Next form, what is P? Promastigote. A pet, A will convert into P, transform into P inside the body of this phlebotomous. So now at this time, your insect is carrying promastigote. All are converted into promastigote. When it comes to next host, then this will bite and what she will leave promastigote, but not directly into blood at the skin. Phlebotomous bite at the skin and below the skin. And if you remember, skin is our innate component of our innate immunity. So below the skin, innate immunity components are there. What is that? That are your macrophages. Macrophages. When any antigen comes, macrophages, they engulf these. So this bite and what it leaves? P, promastigote. So at the site of inoculations, macrophages are there. They will take this promastigote. So once the promastigote, they enter into the macrophages, then what happens? This is the promastigote and this is your macrophage. This is your macrophage. So inside the macrophage, these promastigotes they convert into amastigote, many amastigote. They convert, and these amastigote, which are nothing but your dot and dash, they will keep on multiplying. They will keep on multiplying, and the cell swells up. So this big macrophage, which is full of these dot and dash, this big macrophage now has changed its name. Now it is called LD body, Leishman-Donovan bodies. So what is LD bodies? A macrophage filled with the amastigote. So this is the diagnostic form. When you see the blood at your slides under microscope, you will find LD bodies. So macrophage having these multiple dot and dash like structure. This is called your LD body. So this story is running inside the blood. Suppose this is your infected one, and inside this blood, this is macrophage which is filled. This macrophage is filled with LD bodies, means amastigote. Now from the blood, these macrophages which is containing amastigote or these LD bodies, they move to different organ. This is the leg, and this leg contain bone marrow. So if it enter bone marrow, or there may be spleen, there may be some lymph node. So wherever it goes, this LD body, it will cause, if suppose this goes to the spleen, now my spleen is full of LD body. I call it splenomegaly. Splenomegaly. And if it comes to lymph node, that may cause the enlargement of lymph node. If it comes to bone marrow, then no enlargement, there will be bone marrow suppression. Bone marrow gets separate, all kind of cells which are having their precursors that may lead to pancytopenia. Pan means all, cytopenia means cell, and penia means decrease. So in case of bone marrow suppression, all kind of cells, RBC, WBC, anything, they will cause down. So this is the pathogenesis and the clinical signs of your leishmania. But the story is not yet over. What happens after 2 to 10 years? So these features, they were known as visceral leishmania. Why? Because the visceral organs, spleen, bone marrow, and your other lymph nodes and other organs, they becomes megaly, enlarged in size. So that was a part of visceral leishmania. Suppose you have treated the patient with sodium stevogluconate and any other drug. Then after 2 to 10 years after, again something come called PK tear. PK. What is this PKDL about is, this is your post Kala Azar dermal that comes after 2 to 10 years. So VL is known as Kala Azar. Kala means black, Azar means fever, black means hyperpigmentation. Hyperpigmentation. But in KDL, dermal leishmaniasis, there is dermal means skin, there is hypopigmentation. pigmentation. So this is the difference between VL and PKDL. That happens 2 to 10 years later. So in case of Kala Azhar, in case of visceral leishmaniasis, there is hyperpigmentation, blackening. But in case of PKDL, hypopigmentation is there. That is nothing but your white spots in the skin. So PKDL. So as per classifications, if you remember in the booklet, I have given how to remember that which causes VL, which causes CL, which causes MCL. So in the name itself, V is there, V for VL. Tropica, C is there, C for CL. So like this, you can remember very easily. Donovani, then CL, cutaneous form, visceral form, and one more is your PKDL. That is sequel after 2 to 10 years. That was hyperpigmentation. This is your hypopigmentation. Then diagnosis. The diagnostic form is your LD bodies. Diagnosis is your LD bodies. What are LD bodies? Here is your macrophage, and inside it you will carry some dot dash structures. These are nothing but your AMST code. This is your diagnostic. MCQ related with this Leishmania is culture. There is some triple and media Nicholson like something. But what is important with this culture media is, in case of culture media, A form convert into P form. So if you look at the culture media, what you find? Pro-mastigote. Mastigote becomes pro-mastigote. In the culture, we will find pro-mastigote. So if I summarize in which what we find, uh, this is the animal, and animal carry blood. Blood have macrophages. Macrophage contain a mastigote. That is your LD body. P for phlebotomous. P for phlebotomous. Carry promastigote form. That is your infective form. And this is your diagnostic form. Then culture. In culture media, A transform into P. That is your in culture media. So P is found in two places. One is phlebotomous vector and one is culture. But LD bodies A form only found in macrophages. So this was the story behind your protozoology. There are some other protozoas that will cover in next. For this lecture, we have covered amoeba without any shape and amoeba histolytica. Then some flagellates, intestinal flagellates. Then blood flagellates and leishmania and your trypanosoma. So in case of protozoa, these T and C are important. Cyst and stuff. But in case of Leishmania, if you read Leishmania and your trypanosome, that is important is A pet, these four forms. And out of these, in case of trypanosome, T for T is the diagnostic, T is the infective. But in case of Leishmania, two forms are there, AP forms. A in the man and P in the phlebotomous. So next we'll start with nematodes.
Hello.
Hello.
So there is one test, Montenegro test for Leishmania.
Okay. That is a skin test. Montenegro test. This just simply asks Montenegro test is related with parasite Leishmania. It is type 4 hypersensitivity reaction. Just remember two things with this test, or that the Montenegro present in which form. This test is for which Leishmania? CL, because this is related with the skin. So cutaneous leishmaniasis, Montenegro test, and what is the specific point for this test is your type 4 hypersensitivity. So 3 points are important for Montenegro. One is cutaneous leishmania, and one is type 4 hypersensitivity, and this test for the Leishmania protozoa. No need to undergo much detail of Montenegro because there are many tests like antimony, Chopra's test, and there is one more test like if you look at the ELISA test, there is RK39 antigen. Then we detect antibodies against this RK39 antigen. So just remember their names only. In case of your trypanosomes, there are Buffy-Coat and hematocrit test. So many tests are given, but they simply ask which test present in where and if like Montenegro is type 1 test. So if you want in Montenegro in detail, then I will tell you next class. Okay. The module. Okay. Then starting with nematodes, we have egg, L1, L2, L3, L4, sometimes L5 adult. Then one MCQ asked was, out of these, which is the most common in nematode? So that is your L3 larva. The first family, that is your Ascaris, and species Ascarisome, that is pig. So Ascaris, from the name itself, the location is very much clear. I us. If you make this opposite Si, they are the small intestine nematodes. Most of the nematode, what is the infective stage? L3. But this family, Ascarid family, if we start with pig, because the host is pig, okay. Pig will ingest L2 containing egg. So in case of Ascarid, infective stage is not L3. This is the L2. So from the feces, suppose the parasite adult in the small intestine, and it keep on excreting in the stool what is egg. This will take 2 weeks to develop L2, 2 for 2. So this is the 2. So L2 develop in the environment in 2 weeks. So this L2 is the infective. and it ingested with the food and water something, then this will enter into the body of pig. So if we enter inside the body of pig, so where it will enter? It will enter into the small intestine. So this is the egg. So from the intestine it crosses, enter into blood, then portal blood, then liver, from liver vena cava, from vena cava into right portion of the heart, and then to the lungs. So this is the cycle it follows. So I think it should be. Suppose we make it like this, that this is the small intestine, then from that it will enter into the liver through portal. And in case of liver, okay, your L2 containing, it will molt. Here is the molting, L3 in the liver. From the liver, then your vena cava, then it will enter into lungs, and from the lungs, this route we call it tracheal migration. We call it tracheal migration. So from the bronchi, trachea, the things are swallowed. It will swallow. Then again, after swallowing, comes into the intestine. Further, L4, L5 molting. Adult will be present in your small intestine. So this is the small pathway. This is your adult worm sitting in the small intestine. Keep on excreting in the stool eggs. These eggs take a time 2 weeks and they become 2 L2. That L2 again enter into your pig. This is pig. Then again intestine, cross the intestine, portal blood, liver, molting L2, L3. Then this L3 enter lungs, trachea, we call it tracheal migration, then swallowed. Then this L3 becomes L4, then L5, then adult, then eggs. So this thing keeps on going. So what is the pathogenesis in this cycle? So two things are important with ascarisome. One MCQ is your tracheal migration, and second is the pathogenesis, and that pathogenesis is related with this liver. If I bring the liver out, then you will find milk spot on the liver. So what areas, connective tissue becomes white, milky spot. So many times they have asked, milk spots are related with which nematode? The answer will be Ascaris. So then liver is over, tracheal migration. Then what is the pathogenesis related with your adult worm? As you can see that adults are present in the, so what the pathogenic as compared to, if their number is so high, they can block. And if they block the intestine, that may lead to pain, colic like pain, abdominal pain. So these parasites, they may block. So they may cause the blockade of the intestinal blockage. That if you block this, become constipated and other symptoms. So adult related with blockade, larva with your milk spot, and in the cycle there is tracheal migration, and infective stage, what the pig was eating, L2, what comes out, egg, it take 2 weeks, again the cycle goes on. In this cycle, you have to remember tracheal migration. So this is very simple Ascaris. And the drug of choice in 2019 RPSA VO exam they have asked. So what is the drug of choice? So drug of choice is piperazine 1110 mg per kg body weight oral. So this is your drug of choice. Then in this ascarid family, next member is Parascaris. If you remember, this PAR term is related with the horse because in cestode we have studied Par anaplocephala. That is the smallest tapeworm of the horse. If it was smallest, this Par ascaris, this is the largest nematode of the horse. So both the Par related with the horse. The life cycle is similar to swine or similar to ascaris. Then the important thing was it is the largest of horse. Then come to Toxocara. There are three: Toxocara canis, Toxocara cati, and Toxocara leonina. Out of these, what 2019 and then direct transmission, prenatal, transcolostral. So all type of transmission is present in your T canis. So all four types present in the T canis. But here something absent. Here also something absent. T leo, it is present in cattle. We call it largest tapeworm, oh sorry, nematode of cattle. So cattle do not eat your earthworm, birds, so no paratenic host. But in case direct transmission, P transmission paratenic through the milk, that is colostrum, and prenatal. All routes are there. In case of cat, there is no prenatal transmission. This can protect your cat babies. In 2019, out of these four transmission, which is responsible for the death of puppies? So that is your prenatal. So in case of cat, there is no death of pups, kittens. Why? Because prenatal transmission is absent. So this was related with transmission. Then these four transmissions. First is your direct transmission. If we divide up to 3 months of age and above 3 months of age, then in case of this, we'll find tracheal migration and here somatic migration. So what is somatic migration? Skeletal muscles, liver, other organs. So if this, so larvae or they migrate into these structures, skeletal muscles and other, it is somatic migration. And tracheal migration similar to your ascarisome, where the things are migrating in the trachea. So what is the important with these migrations? In case of these Toxocara, these are the member of Ascaridae family. So L2 is the infective stage. So from L2 to L3, there is molting. There is molting. And if this molting, if you remember in Ascarisome, this was in liver. From the liver, L3 move lungs, trachea, tracheal migration, then again intestine. So this is the tracheal migration, where in the liver L2 becomes L3. Then there is one more, transplacental, through the placenta. In this case, this L2 to L3 mold, now it occur in case of lungs. So this is the difference between your tracheal migration and your direct transmission and your transplacent transmission. That L2 to L3 mold liver, and here it is lungs. Then there are two other forms. One is direct through the milk, that is transcolostral transmission, and one is through paratenic host. Suppose this is the animal where this is the mammary gland and these are the puppies. Through the milk, larvae come out. This larvae enter into the puppy and larva becomes adult. Then the things get stopped at this point. It means there is no migration. If you remember, in case of ascarisome and in case of direct transmission, these adults from the intestine they move to portal circulation, then liver, molting, then lungs, trachea, swallowed again. But these things not occur in case of transcolostral transmission. They take the milk, take the larva inside body, larva becomes adult, and then story stop. No migration. Then the next is through the paratenic host. Suppose this is the paratenic host, that is your rodent. That is your rodent. And the story again start with the L2. L2 present in the egg. They ingest the egg, this rodent. Then this rodent is eaten by your dog. Your dog eats the rodent. Then inside the body of dog, what comes out? L2 larva. It becomes adult. Again, no migration. Adult becomes adult, start giving outside stool egg. So four type of transmission. Direct transmission. One was transplacental. Then this your transcolostral and your paratenic. If you compare, because these points are very important, they have asked questions, MCQs. Direct transmission, two types of migration. One is tracheal, one is somatic. Then trans P, transplacental. There is L2, L3 molting occur in the lungs. And here L2, L3 molt occur in liver. Then transcolostral, no migration. Transmission through the paratenic host, no migration. So here is the migration and no migration. So if you look at the pathogenesis, that 2019 MCQ, pups die heavy mortality, that is because of prenatal infection. And if you look at the diagnosis of Toxocara canis, subglobular egg will be present, and these are brown in color. If they become colorless, we call them egg of Toxocara cati. or Leonina, because in both the cases eggs are colorless. These are brown globular egg. There is one more term related with the T. canis, visceral larva migrans. That is your VLM, T. canis mainly. This happens in case of children's below 5 years playing in the park or playing with the dog in the soil. Larvae migrate, penetrate them, and manifestations come. Then what are the manifestations as they enter through the skin? There are some pathogenesis, that is hepatomegaly, eosinophilic lesions in liver, lungs, brain. So these are the visceral organs which are affected because of the migration of larvae. So more important is it is related with the T. canis. So T. cati, if you look at the structure of the T. canis, they are arrow-headed worm. Why they are arrow-headed? There is one structure, cervical alai, A-L-A-E. We call them cervical alai because of they are arrow-headed. In case of T. cati, these alai, they are perpendicular to the body. But in case of Leonina, they are lanceolate. They are lanceolate, not perpendicular. This cervical alai. This is a small difference. L for lanceolate, Leonina. Cati, they are perpendicular to the body. So the largest nematode of cattle and buffalo, that is your Toxocara leonina. What is absent? Transmission through PT, paratenic host, absent. You can remember like this, that paratenic host like earthworm, rodent, and birds. Our cattle do not eat rodent or bird, so no paratenic host transmission present. Other are present: direct, transcolostral, transmammary. So if we look at the calf, there is a death of calf, and this is known as calf hood disease. Calf hood disease, and that is more commonly through the transcolostral. When they take the milk contain larvae, they enter into the body of calf, and they are more pathogenic, and there will be diarrhea, and that diarrhea is also characteristic, and it was asked in your exam that this diarrhea is first is foul smelling diarrhea, and this is muddy in color, just like mud. Foul smelling muddy diarrhea, characteristic of your uh, Toxocara leonina. And second is sometimes fat also comes, steatorrhea. So these three features with the calf foot disease, mortality of calf, because this is more pathogenic in calves, and the drug of choice is your pyrantel palmoid. In case of ascarisome, it was piperazine, and here PP, pyrantel palmoid is your drug of choice. Then there is some small nematode like Oxyuris equi. From the name, we can derive many MCQs. This O,
Sir,
one side is
Toxocara
red.
vitlo-
Hello. What?
sir, Toxocara vitlora. Toxocara vitlora.
Toxocara. So you want some repetition. See, in case of If you remember that Toxocara, Canis, Cati, and Vitulorum. Direct. In case of Vitulorum, similarly, we have studied
Sir, in
direct
cat,
transmission. What in cat? Your voice is not clear. This Vitulorum is related with your cattle and buffalo, mainly their calves, so-called calf foot disease. There is direct transmission, but no paratenic host. There is transcolostral transmission, and there is trans what you call memory transmission. Transmemory, transplacental, and direct, but no paratenic one. So for Vitulorum, just remember more pathogenic for the calf. Adults will not die. These are the calf, so-called calf foot disease. And why this is more pathogenic? Because it causes diarrhea, severe diarrhea, foul smelling, muddy color that may cause even death of your calf. And which stage is absent? Paratenic transmission is absent. That's it. And these are the member of Ascarid family. So the infective stage is always your L2. So Oxyuris equi. This O will tell you 4 to 5 MCQs. O means one spicule. O for one side flat. This is one side flat, and one side there is mucosal plug, which is the characteristic of the egg of Oxyuris equi. Equid plug, and we call it pinworm. Pinworm, or as it is found in the large intestine, so we also call it rectal worm. It is also called rectal worm. So what is more important for this Oxyuris equi is suppose this is the anal area, this is the anus area, and this is your rectum, this is your worm. When it moves, the female worm comes out by crawling. In this perianal region, it causes irritation. So we call it anal pruritus. So this is the female worm present in large intestine. When it comes out, when it crawls around this anus region, it causes irritation called anal pruritus. And because of this anal pruritus, the animal, suppose this is the tail of the animal. This is the tail of the animal. Because of this irritation, the animal keep on rubbing its tail with some structures, and if you rub the tail, there will be loss of hairs. So the tail will appear or look like rat tail, because if you look at the tail of a rat, it is always hairless. There are no hairs in the rat of the tail. So we compare this tail where loss of hair, we call it rat tail appearance. So there are two things which Oxyuris equi. Remember, the site near to anus, that is your rectum, your large intestine. Then the female worm crawl out, cause anal pruritus. Then this is the tail, and rubbing of tail, rat tail appearance. And the characteristic of your eggs, that is one side flat and one side your plug. This is about your Oxyuris equi. Next, there are two nematodes. One is Ascaridia galli and one is your sickle worm. We call it Hetrakis gallinarum. So there are two, Escherichia galli. Okay, and the second is cecal worm, H. gallinarum. Your cecal worm. Escherichia, in the name it is given Escherichia, means there is something there is similar or common like Ascaris worm. So what is that similarity? As we know, Ascaris is found in small intestine. So this is also small intestine. In case of Ascaris, L2 was the infective. Again, L2 is the infective. Then Ascaris was the largest nematode. It is also largest nematode. But that was of pig, but this is of poultry. So these three things similar with the Ascaris. Your small intestine, your L2 or your largest form of poultry. But this Hetrachis, as the name implies, cecal worm. So the site will be cecum. Because in the name there is no Ascaris. It is all Ascaridia is Ascaris carrying name. So all things similar with the Ascaris. So Hetrachis gallinarum, cecal worm, your location will be cecum. So this is non-pathogenic. This is non-pathogenic. So there is something related with this cecal worm, and that something is inside the egg of this you will find Histomonas miliacritis protozoa. That was related with black head of turkey. So as Ascaridia like birds, mainly they most of the time they eat earthworm. So paratenic host is the earthworm in both the cases. Ascaridia galli or Hetrachis. Earthworm is the transport or paratenic host. And this is related with the small intestine. So all the pathogens are related with the intestine, like inflammation, enteritis, and other things. Then come to strongyloids. There are strongylus and strongyloids. It's like a strongyle. Strongyloids. Oids means just like strongyles. So their life cycle or everything is different from all other nematodes. Here, the female are parthenogenic. Without fertilization will give the egg. Parthenogenic. And these are like a hair. So we call them like a thread. We call them thread worm. Pathogenesis. They are host specific. There are many species, strongyloid, uh, papillosus related with the rumen papilla in ruminant and avium for birds. So like this. But what is important is strongyloids, the infective stage of L2 is there is no L2 story after this. We'll find L3 from strongyloids. So strongyloids we have L3 as the infective stage. In strongyloids there are two types of cycle. One is homogonic and one is your heterogonic. That is very important. It means free living and parasitic form both are present. Suppose this is your animal and from the body of animal what comes out? Egg. And from the egg there are two conditions. favorable condition or unfavorable condition. Favorable and unfavorable condition. In case of unfavorable condition, adverse condition, the parasite shows parasitic cycle, and in case of favorable conditions, it is showing free living cycle. Suppose this is the egg, and now the condition is adverse or unfavorable. So they will show parasitic mode. Means from this what comes out, L1 become L2 and the infective stage L3. That will infect, and these strongyloids, they are present in the small intestine, becomes adult. This part under unfavorable condition, adverse condition, this cycle. Suppose the environment or condition is favorable, then it will show free living path. This is L3, becomes L4 and becomes L5. Then after L5 there is adult. These adults, there will be parthenogenesis and formation of larvae. L1, L2, L3. They may be again becomes free living cycle or becomes infective parasitic cycle. So in this way, two type of cycles are present in the environment. The MCQ is, in case of strongyloids, why it is impossible to control this parasite. So the answer is the parasite can survive in both the situation. If the condition is favorable, it is present as free living. And if the condition becomes, situations become unfavorable, adverse, it will start parasitic mode. It will start living parasitic mode, where enter small intestine, cause enteritis, other pathogens. But because of this two mode of because of these two mode, one is free living mode, one is parasitic mode, this parasite will never eliminate from the environment, because if you remove one, other form is also there. So if you provide unfavorable condition, becomes parasitic. If you provide favorable, it will become this. So homogonic, heterogonic things continue. Such type of cycles are present in strongyloids, and parthenogenesis is present in also present in your strongyloids. Then the true, we call them true strongylus. Strongylus. There are three species, and their morphology is very important. One is your vulgaris, that is more vulgar, it is most pathogenic. That's why it is called vulgaris, the vulgar one. Then your Strongylus equinus, or last is your Strongylus edentatus. So the MCQ is regarded with their buccal cavity. With their buccal cavity. Enucleated, no nucleus. Edentation, E means no dentation, means no teeth. There are no teeth. If you look at equinus, Strongylus equinus, this make the E like this. So there are three teeth in this buccal capsule. There are three teeth. One is large, bifid, and two are small. Then come to vulgaris. In case of vulgaris, there are two teeth. Suppose these are 1 and 2. So this is your MCQ. They have asked in one exam. The out of these, which species carry three teeth? Equinus. E for three. Edentators like enucleated, absence of teeth, no teeth, three teeth, and two teeth. Then, with their pathogenesis, out of these three, the most pathogenic is your vulgaris. And this Strongylus vulgaris, if this is the body of the animal, then these are cranial mesenteric artery. Inside the cranial mesenteric artery, your Strongylus vulgaris is present. So it can cause the inflammation, arthritis, it may block, or it may cause aneurysm. Aneurysm means dilatation of the artery, like this pouch-like structure. So it may block it may cause endarteritis, arthritis, and the aneurysms. So the pathogenesis is with the cranial mesenteric artery. So because of this, the cranial mesenteric artery, suppose it supplies to this part of the intestine and it is blocked, then this part will undergo necrosis, gangrene, and there may be colic in case of horse because of compromised vascular supply. So in case of these two, edentatus and equinus, there is formation of, as they are found in intestine, formation of some nodules, and that may be hemorrhagic nodules. Both are present in equinus and your edentatus. Then next is your pimply gut, esophagostomum. Esophagostomum. In case of young animal, the pathogenesis of this is dependent on the immunity of the animal as well as the species of host. So young animal, and these are the old and reinfected. If the first time exposure is there in the intestine, there will not be formation of any nodules or any pimply gut. So this time, if the larva enters, they may cause small ulcerations or bleeding, but there is no nodule formation. But the animal is old or animal is infected second time, that is reinfected, then there will be antigen antibody reaction, immune reaction. Because of that immune reaction, there is infiltration of cells like your eosinophils, lymphocyte, other cells. And these infiltrations, these things lead to formation of nodules, and these nodules, they are surrounded by some fibrous capsules which later on becomes calcified, and the whole, suppose this is your gut, and at this gut if there are many nodules formed and they fibrosed, encapsulated, they are calcified, we call this pimply gut. The gut looks like having small pimples or naughty guts, and these are calcified. So all these things are uh, related with the intestine. So the clinical signs will be diarrhea with blood, mucus, and emaciation and loss of condition. Then next, there are some other worms like Stephaneurus dentatus, which is the kidney worm. So Stephaneurus dentatus is the kidney worm, and the more important thing is the diagnosis. It means it, the sample is urine, and you will find the egg. Stephaneurus dentatus, that is pig. Then Synghamus trachea. Synghamus is the poultry nematode. Synghamus trachea. It means it is related with the trachea. The more important with this worm is there are male and female. Always remain in copulation, or we call them permanent copulators, and male and female. And this is related with the trachea. So in case of bird trachea, if the parasite causes trachea and bronchi infections that may lead to gaping or gasping, that is dyspnea, and difficulty in the breathing. So this is Synghamus trachea or gapeworm. The whole pathogenesis is related with the upper respiratory tract. Sometimes lungs are also affected, then there will be pneumonia that occurs only in case of heavy infections. Then the more important is your ankylostomas. Hookworm. Why the name is given hook? Because their anterior part is bent like a hook. So we call them hookworm. So in case of ankylostoma, there are there is one mnemonic A, B, C, D. A for ankylostoma, B for brasiliensis, C for caninum, and D for dog. So this is how we remember species of ankylostoma. But in case of buonostomum, there are two species and they have asked in exam. One is trigonocephalum. ZO, it is present in goat. And the second one is phlebotomum. Phlebotomum. That BO for bovine. So this was asked in 2019. The trigonocephalum buonostomum present in which species? Answer will be goat. GO for goat, BO for bovine. And these ankylostoma, there are A for all the four type of modes are present. Means through the ingestions of your L3, your skin penetration, transcolostral, and your transplacental. All the four types are present, and egg of the ankylostoma, these two sides are parallel to each other, and this is eight-celled embryo. So eight-celled with parallel side, the characteristic of the ankylostoma egg. So this parasite is a blood-sucking parasite. It means 0.1 ml blood it sucks that may lead to anemia, and that anemia is hypochromic anemia. Microcytic cell becomes small, hypochromic anemia. So the more important sign symptoms with ankylostoma is the anemia. So this ankylostoma present in the small intestine of your dog. So one pathogenesis is related with the intestine and one was with the uh, anemia, that is your blood sucking activity. So these intestine, because the buccal capsule of the ankylostoma carries some teeth, and with the help of these teeth, it grasps mu- mucosa of intestine, and because of that, it may lead to bleeding. So these teeth of the buccal capsule, it grasps the mucosa and eat the plug of mucosa that may damage arterial blood supply and cause bleeding. So with ankylostoma, there is bleeding, and that is called hemorrhagic enteritis because blood with enteritis. And second is microcytic hypochromic anemia. And with duodenostoma only species is important. And then the more important thing is your GI gastrointestinal nematodes like your Haemonchus and these. These are very important. First is Trichostrongylus. With Trichostrongylus, there was one MCQ in I think 2018 that there is one species Trichostrongylus AXEI. A for abomazum. It is present in abomazum, and in case of abomazum, it causes ringworm like lesions. It causes ringworms like lesions. This is related with Trichostrongylus XC. Abomasum, ring-like lesions. And this parasite is present in abomasum. So in case abomasum means through stomach, suppose these are the glands in the abomasum. These are the glands. This parasite is present in between the glands. In between the gland. It is not present within the gland. This is the location. And second, in abomasum, it causes ringworm-like lesions. Next, your GIT osteotasia. This is very important because in the abomasum, there are gastric glands, and this parasite destroy gastric gland. If you destroy the gastric gland mass, then these parietal cell will decrease in number. And what is the role of parietal cell? HCl secretion. HCl secretion will decrease. And what is the role of HCl? To convert the pepsinogen into pepsin. So pepsin activation will not be there. So if you destroy the glands, less parietal cell, less HCl, and less activation of the enzymes. And the second thing is the increase permeability. Increase permeability of the abomasal epithelia. If you increase the permeability, then there will be loss of proteins. Proteins in the stomach, they are pepsin, and there may be some other plasma proteins. So if protein are lost, then there may be hypoproteinemia, and that may lead to edema. So this is the pathogenesis related with this osteotasia, and these uh, glands, because of hyperplasia, hyperplastic things occur that form nodule, and we call it, the appearance is Morocco leather appearance, which is nothing but hyperplastic or hyperplasia of the gastric gland that may give it a nodular appearance. So, gastric gland destroyed, fatal cell less HCl, more permeability, protein less, hypoalbumin, hypoproteinemia, then edema. So, edema and hyperplasia, molecular appearance. These things are related with the osteotasia. Because it is affecting the abomasum, then there may be diarrhea also. Next, the most important MCQ or topic is your self-cure phenomena. And this self-cure phenomena is related with the nematode Haemonchus contortus. So in case of self-cure phenomena, this is the GIT. At this place, some adult worm are sleeping. Adults are present. So if you give larval challenge, so these larvae will come inside and they molt from L3 to L4. L3 to L4 molting occurs. So during this molting, some molecules are released and that are known as antigens. There are mast cell having IgE. These antigens bind with the IgE and there is mast cell degranulation that may release histamine and your serotonin-like molecule. And this is known as type 1 hypersensitivity type 1. So because of histamine, it will cause vasodilation in the intestine. It means more fluid will be there in the intestine, more fluid environment. And the second thing, it also causes smooth muscles contractions. Smooth muscles contraction. So your GIT is full of fluid and smooth muscles are contracting. So it will expel the adult outside of the body. So this is known as self-cure phenomena where larval challenge, or these are the larvae, they expel the adult worm outside of the body. How do they expel? First they molt L3 to L4. During molting, they come, they molt, and during molting release antigen, bind with the IgE on the mast cell, degranulation, histamine that may cause vasodilation, fluid accumulation in the lumen, and with along with this contraction, and move them outside. Dislodgement or expulsion of your worm. This is the self-cure phenomena. Then one more important topic with this Haemonchus was asked in 2019. That is spring rise. So what is spring rise? It means number of egg increases. At what time? Around the time of parturition. So what happens around the time of parturition? At the time of parturition, immunity decreases. At the time of parturition, there is milk letdown, there is milk synthesis. So what comes out? Prolactin. So these factors like your prolactin, low, reduction of immunity, the parasite becomes more active at this time and they keep on excreting more and more number of egg. We call this spring rise, peri-parturient rise. So there is rise in number of egg around the time of parturition. There is prolactin, there is immunity down, make the worm happy. They gives you more egg. Number increases. We call spring rise. We call PPR. So this phenomena in 2019 they asked why this spring rise phenomena happens around the Parchi because of prolactin and the lowering of the immunity. Then there is one term hypobiosis. Hypobiosis is nothing but your arrested development. Hypobiosis, arrested development means and some larvae they stopped developing further. They wait for the favorable conditions, then develop. So there are many examples. Homunculus, then Nematodes Protozoa like. Then Dictyocolus viviparus, that is related with the lungs. So it is called lungworm. The more important thing with your 2 MCQ Dictyocolus viviparus. This is the your gumboot. So there is gumboot like spicules in case of male. And the second MCQ in related with the life cycle they have asked that this is the lungworm, okay, then how do they reach to the lungs? These are the lungs and your worm is present somewhere here, intestine. How do they reach? So first they will find lymphatics, intestinal mucosa. Then within the mucosa we have lymphatics. Then they enter the mesenteric lymph node. Then that drain into thoracic duct. This thoracic duct and thoracic duct open itself in the heart and from the heart they will enter into lungs. So this is the lymphatic pathway that from mucosa lymph channel, then lymph node, thoracic duct is also a lymph channel, big lymph channel. Then they open into heart, then the lungs. So this is how your viviparous enters. And the pathogenesis is all related with the lungs and with this ICAR 2019 they have asked about the post-mortem finding of your uh, dictyocolus. So inside the lungs you will find these alveoli collapse, atelectasis, pulmonary edema, pulmonary emphysema, and some exudate and with that worms. So post-mortem finding of dictyocolus. And similarly, we have Metastrongylus apri, that is the lungworm of the pig. Uh, Metastrongylus apri, that is your lungworm of pig. The pathogens is similar to that dictyocolus, that is your pulmonary emphysema, then consider verminous pneumonia. And in this case, the important thing is the intermediate host, that is the earthworm. Intermediate host, earthworm. Then there are some eyeworm also present, like there are two Thilagia and one is the poultry. In 2019, in one PSC exam, they were about the poultry worm, that is Oxyspirura mansoni. So, eyeworm may be found in poultry or Thilagia species in the conjunctival cell coria. So, the important thing about this eyeworm is, suppose this is the eyeworm. This eyeworm is having these spines, these cuticular spines or this. Because of these structures, when it is present in the eye, these things causes irritations or all the ocular pathologies like keratitis, opacity, and because of these serrations or these margins. So these cuticular striations, they are responsible for the damage to the eye. Then Spirocerca lupi, that is your esophageal tumor worm, where the host is dog, and from the dog, larvated eggs comes out, and the infective stage is obviously the L3 larva, and these L3 larvae, they enter into your intermediate host and paratenic host, and then again enter into the body of dog. So the cycle goes like this. Intermediate host is your beetle, and paratenic host or transport host are birds, amphibia, or reptiles. The more important pathogenesis is the esophageal wall granuloma formation. There is aorta, this is the heart, and from the heart comes out aorta. So there may be stenosis of aorta or there may be rupture of aorta. And the second thing is this is the esophagus, and this is related with the esophageal granuloma formation or osteosarcoma. These structures are known as granuloma. So esophageal granulomas and aorta ruptures, these are the Spirocerca lupi. This is esophageal tumor worm. Then the heartworm of dog. With the heartworm, what is important? So this location is important. Your right ventricle, and from right ventricle, what comes out is the pulmonary artery. So these are the two locations, right ventricle and pulmonary artery. They are blocked, and intermediate host is the mosquito. So with the Dirofilaria, we have mosquito as intermediate host, and the location is right ventricle and pulmonary artery. So because of this, in the right auricle, vena cava is draining. If there is blockage, then whole the blood will enter into vena cava. So we call it vena cava syndrome. Lot of parasite they block this. If they enter into this and also block this vena cava is collecting the blood from the liver. This is collecting the blood from the liver. So in this case, because of backflow, liver is also affected. That may lead to your jaundice, breakage of RBC, hemoglobinuria, and uh, bilirubinemia. More bilirubin will come into the blood because of the damage to liver. So this filarial worm, there is one important test, that is your NOT test, where 1 ml plus 9 ml. What is 1? That is blood, or 9 ml is your formalin. We take this total 10 ml, then we do centrifugation. We centrifuge it and examine the sediment. After centrifugation, the sediment is stained with the methylene blue and then examine the microfilaria. So this is the NOT test, where 1 plus 9 ml, 1:9 it is taken. Then there are some abdominal worms, Citeria digitata. One important thing about this, in case of usual host, they are non-pathogenic. If they enter into unusual host, then they migrate and damage some structures. Suppose this larva, Citeria digitata, the usual host S digitata. Usual host is cattle buffalo. If it enter into sheep, then it will enter into migrate and enter into the brain and spinal cord. That may lead to cerebro brain spinal nematodiasis. So cerebro spinal nematodiasis, which is having one more, and this is the part from nerves goes to lumbar area. So there will be lumbar paralysis, lumbar paralysis, and this disease is also known as KUMRI, Kumri. So there will be damage to the brain, damage to the spinal cord, cerebrospinal damage, and this area gives nerves to the lumbar area, so lumbar paralysis. So this was then Stephanofilaria. Stephanophilaria. Only etiology is important. There are three species, Asamensis, because this is related, all the pathogenesis related with the skin. Then next is your something Jahir and Kaeli. So from the name you can remember HUMP, M for M, hump sore, E for E, that is ear sore, L for L, leg sore. So in the match the following, or out of which of the following known as hump sore, they can ask species of Stephanophilaria. So these are the MCQ asked with this parasite, which is known as hump sore, M for M, E for E, L for L. So very easy. Then comes your dracunculosis, the symbol of veterinary. And more important for this is the mode of transmission, that is your drinking water. It means the drinking water carries some infective things and they are known as cyclops. Cyclops. So the drinking water will carry your cyclops. And the disease is known as uh, dracunculosis, or this worm is guinea worm or serpent worm like a snake. So cyclops is very important, and other important is mode of infection where drinking water. And this pathogenesis is related with the skin. That is, it causes allergic reactions in case of man, in case of dog, and that allergic reactions are mostly at the lower part of the leg. Here, some allergic reaction, and there may be some ulcerations. These are related with your dracunculosis. But now this disease has been eradicated. So they ask you only one thing, that is mode of transmission, drinking of water, and second is cyclops and the synonyms. Then Trichinella spiralis, this in 2019, the host of Trichinella spiralis, man plus your pig. This was the answer. So they have asked this Trichinella spiralis, and this is because of uncooked or eating of raw meat which contain the larvae. So inside the body, inside the body of host, inside the muscles, the larvae goes and they becomes encapsulated, and these once they are eaten by uncooked or raw, then these muscular part they carry the larvae in the form of nurse cell. So nurse cell is nothing but the larvae enclosed within the muscle cells. So nurse cells are characteristic of Trichinella spiralis. So the diagnosis is it is related with the meat or muscles. So muscle biopsy, and mostly this uh, nematode is less pathogenic or asymptomatic. Then just like oxyuris, we have trichuris, whipworm. If you look at the shape of the whipworm, this part is thick, coiled. Anterior part, this is the posterior part. Anterior part is like this. So we call it thin, long anterior part, and this is thick posterior part. This is your whipworm. The egg are important. Barrel shaped, and both the poles they have mucosal plug. If you compare with the oxyuris, one side flat and one side plug. That was your oxyuris, O for 1, T for 2, trichuris. These are the difference in egg. So this whipworm, the morphology is very important, and its location is intestine. So all the pathogenesis will be like enteritis, diarrhea, all these things. Then there is one diaptofema. species is renal. D4, that is your dog, and the D comes in kidney also. So this is the kidney worm of dog because the species is also renal. Kidney worm of dog. This is less pathogenic and important is the intermediate host, that is your earthworm annelid. So there are two nematode where earthworm is the intermediate host. One was your Spirocerca lupi, I think it was lupi, and this is your Dictyophama renale. Earthworm is the intermediate host. Kidney worm. So other things in nematode, they are just only the synonyms and species you can read. Then the next part in tomorrow's class will be remaining protozoa like Babesia and others. There is one class remaining about this sporozoa, blood, Toxoplasma gondii and those. And along with this small portion, we'll cover general parasitology plus entomo. So tomorrow we'll finish our parasitology part. So these were some nematodes and protozoa. So if you find any difficulty related to their life cycles, you can ask. But in nematodes, there is nothing. If more you read, more you remember. Like this is intermediate host, this is the final host, and these are the test and specific eggs, bipolar, unipolar, and in case of strongyloids, the morphology, teeth. But in case of protozoa, the life cycles and other parts are very important because protozoa are more important than your nematodes. In nematodes, simple like synonyms or pathogens, small questions are asked. But in case of protozoa, I have covered throughout all life cycles that will help you in solving most of the questions, like Leishmania, all forms, trypanosomes, Giardia, all others. But in case of nematodes, the importance they have asked, like spring rise, like your self cure, and other small phenomena, like so. It's all. I think we should close it. It's 12:03. So any doubt with nematodes?